Good evening, everyone. We are from Laboratory 2 and our research topic is Knowledge, Attitude and Practice of Dengue Fever among Pusat Perubatan Universiti Kebangsaan Malaysia, PPUKM undergraduates. Our facilitator is Dr. Juliana binti Mansor and our lab members are Fariha, me, Fatin, Povisha, Wendy, Zikang, Nazmin, Tipen, Suhan, Wanchi, Bashir, Diana, Adila and Valerie Chong. First of all, we from Lab 2 would like to show our gratitude to those who assisted and guided us throughout the completion of this report. It is an honor for us to acknowledge Dr. Azmi Tamil, who gave us the opportunity to work as a team to complete this report within the time given. Moreover, Dr. Azmi has given us vital materials and advices in order to complete this research. With gratitude, we would like to thank our supervisor, Dr. Juliana binti Mansor, whose encouragement, guidance and support from the initial to the final step of this research has enabled us to develop an understanding of the subject and in completing this medical society research. Last but not least, we offer our regards to all of those who supported us in any aspect during the completion of this research. To date, Malaysia has recorded an alarming number of dengue cases, with Selangor State at the top of the list. It is only rational that this study is carried out and aimed to explore knowledge, attitude and practice (KAP) of dengue fever among PPUKM undergraduates who are living at close proximity to this infection. PPUKM undergraduates were given a questionnaire to answer and their level of KAP of dengue fever were assessed. We then determined the affiliation between these and their demographic backgrounds. We have also explored on how knowledge and attitude may affect their practice of dengue fever. As an introduction, dengue fever is a vital public health problem which is epidemiologically and ecologically related to human lifestyle and activities. Nowadays, dengue is the ordinary and quickly spreading mosquito-borne viral disease in several parts of the world. Dengue is a vector-borne infection transmitted principally by infective female Aedes aegypti and also by Aedes albopictus mosquito, caused by dengue viruses then V1, then V2, then V3 and then V4, which are flaviviruses. Dengue can be divided into two main forms, which are dengue fever and the worst, dengue hemorrhagic fever. Infection from dengue virus also can cause a wide range of clinical problems such as asymptomatic infection and mild flu-like symptoms. Outbreaks of vector-borne diseases such as dengue can devastate health systems, especially in resource-poor countries. Dengue found in urban, most tropical and subtropical countries in the world. A major public health problem, it is affecting 50 to 100 million world population residing in the endemic dengue area, where there is constant presence of the infection. The epidemics or outbreak of dengue causes not only human suffering, but also puts a strain on the economy and health services of a country. In recent years, the prevalence of dengue fever has been increasing in the country. It has risen to an alarming state to Malaysian health authorities as there is no definite cure for it. However, it can still be prevented by many effective ways. Unequivocally, reducing the incidence of dengue also depends highly on the knowledge, attitude and practice of the society towards the disease. Therefore, this research is performed to study and analyze the KAP towards dengue fever among first and second year of medical students of the National University of Malaysia, UKM. The relevance of this study is raised up because dengue fever is still a major public health concern in Malaysia despite the vigorous efforts done. As an example, Communication for Behavioral Impact, Combine Program and the Wulbasha Project. It is also relevant to be conducted among the medical students as in the near future these are the doctors who will combat the disease itself. As the study unveils the students' level of knowledge, attitude and practice of dengue, it will also evaluate the relationship between them and factors affecting its level, which will be useful to amend what is lacking now for the betterment of the society in years to come. The questionnaire we used through Google Form was broken down into two different sections. The first section is comprised of acquiring the students' demographic data, such as gender, ethnicity, as well as their year of study. Then the second section is consist of brief multiple choice questions and the rating scale questions, which will consist of the education exposure towards dengue, knowledge, attitude and practice on dengue among PPUKM undergraduates. The questions being asked are such as, what is the relationship between gender and KAP among PPUKM undergraduates? What is the association between ethnicity and KAP on dengue? And what is the link between the year of study and KAP of dengue among PPUKM undergraduates? Our general objective is to determine the level of knowledge, attitude and practice on dengue fever among PPUKM undergraduates. Our specific objectives are to determine affiliation between knowledge, attitude and practice on dengue fever and gender of PPUKM undergraduates, to determine the link between KAP and ethnicity of PPUKM undergraduates, to determine the association between KAP of dengue fever and year of study of PPUKM undergraduates, and lastly to assess the relationship between knowledge and attitude on practice in regards to dengue fever.
Hypothesis 1. The level of KAP of dengue fever among females is higher than that of males of PPUKM undergraduates. 2. The level of KAP of dengue fever has no significant association with different ethnicity of PPUKM undergraduates. 3. The level of KAP of dengue fever among second year is higher than first year of PPUKM undergraduates. 4. There is no correlation between KAP in regards to dengue fever. This data is obtained from National Crisis Preparedness and Response Centre, CPRC, Disease Control Division, Ministry of Health Malaysia. It shows the number of dengue cases in our country to date and as well as cumulatively from 30th of December 2018 to 9th December 2019. There were a total number of 122,751 cases, with Selangor had the most number of dengue cases, 68,108 cases, followed by Kuala Lumpur, 13,740 cases, and subsequently Johor, 10,333 cases. Overall, the occurrence of dengue cases in our country over the past 1 year is definitely an area of concern. Based on a recent study on factors affecting KAP of dengue fever among selected urban, semi-urban and rural communities in Malaysia, attitudes toward dengue fever were significantly associated with the level of education and employment status. Meanwhile, practice was associated significantly with age, marital status and geographic area, and knowledge on dengue fever. In year 2015, Zul Izzat Ikhwan Zaini and team conducted a cross-sectional study titled Knowledge and Practices Regarding Aedes Control amongst Residents of Dengue Hotspot Areas in Selangor, which involved 152 respondents. Their research had shown that there is a significant association between knowledge and practice of methods of the control and prevention of Aedes mosquitoes based on Aedes larvae ovitraps, mosticide, Dengue, and other approaches. Aside from this valuable finding, their research also shown that there is a strong and significant correlation between knowledge and practice scores of these residents. It is of note that these areas are at the close proximity to our PPUKM undergraduates community. Tan Kok Leong from Community Medicine, IMU Bukit Jalil, Kuala Lumpur, Malaysia had carried out a study about knowledge, attitude and practice of dengue fever among rural communities in Rembau and Bukit Pelanduk, Negeri Sembilan, Malaysia. It was found that knowledge among the respondents was only adequate and their main source of information on dengue was from the television or radio. There was significant association between knowledge and attitude. Knowledge was associated with age, ethnicity and educational level. Attitude was associated with ethnicity and educational level, while practice was associated with ethnicity and marital status. Overall, there is a strong relationship between the respondents' demographic backgrounds and their KAP of dengue fever. In 2015, Bausam Mahdi Nazil Al-Zurfi and team conducted a study among 204 Form 4 students on knowledge, attitude and practice of dengue fever and health educational program among students of Alam Shah Science School, Cheras, Malaysia. The study showed that there was no significant association between knowledge status and race, and no significant association between knowledge status and socioeconomic status. Localities of students were not affecting their knowledge status, as the relationship between localities and knowledge status was not significant. However, there is a significant relationship between knowledge, attitude, and practice of dengue fever and health educational program among students, and there is an increase in the mean score of knowledge after the conduction of health educational program. Methodology. Study location: UKM's Medical Faculty in Cheras, Kuala Lumpur. Study design: cross-sectional study. Study duration: from 1st of November to 19 November 2019. Sampling population: pre-clinical medical students consisting of Year 1 and Year 2. Sample size: 146 participants. Sampling technique: questionnaire via Google Form. Limitations: 1. Personal information, for example, name and age of the respondents are not collected. 2. Questions regarding KAP was not separated distinctively in the questionnaire, hence further investigation is required. Study variables and operational definition. Gender: the sex group of respondents, male or female. Categorical: PPUKM undergraduates. PPUKM undergraduates refer to the Year 1 UKM medical students, Session 2019-2020, and Year 2 UKM medical students, Session 2018-2019. Categorical: ethnicity: a measure of cultural affiliation which have a shared sense of common origins or ancestry and a common geographic origin, Malay, Chinese, Indian, and others. Categorical. Dengue. Dengue is a vector-borne infection transmitted principally by infective female Aedes aegypti and also by Aedes albopictus mosquito, caused by dengue viruses Den V1, Den V2, Den V3, and Den V4, which are flaviviruses. Categorical. Knowledge. Knowledge refers to PPUKM undergraduates' ability to recall the facts and information regarding dengue fever. Categorical. Attitude. Attitude refers to the way PPUKM undergraduates behave towards dengue fever that shows their level of thinking and feeling. Categorical. Practice. Practice refers to PPUKM undergraduates' actions in response to dengue fever. Categorical. Relationship score. Gender: male or female. Ethnicity: Malay, Chinese, Indian, and others. Year of study: Year 1 and Year 2 medical students. KAP: good, score 1, mean equals to or more than 92.1. Poor, score 0, mean equals to or less than 92.0.
Results: statistical analysis. Data analysis in this study was aided by the use of statistical package for social science SPSS version 23. In descriptive analysis, categorical data such as gender, ethnicity, year of study, and KAP on dengue are tabulated and divided into both frequencies and percentages. The statistical test used in this research study is chi-square test. Throughout this study, a two-tailed p-value less than 0.05 was considered as statistically significant. Descriptive analysis. Out of 146 respondents, 27.4, which is 40 of the respondents were male, and 72.6 of the respondents were female students. There were also 63.7% of Malay students who responded to our questionnaire, 17.1 Chinese students, 11.0 others, and 8.2 Indians. 68.5% of our respondents were the second-year medical students, and 31.5% were the first-year medical students. Results: analytical analysis. Association of gender and KAP of dengue. Among males, 57.5% of them have poor KAP score, while the remaining have good KAP score. Among the females, 43.4% of them have poor KAP score, while the remaining have good KAP score. Overall, higher percentage of males have poor KAP score compared to that of female, and vice versa for good KAP score. However, based on our chi-square test, P is equal to 0.128, which is more than 0.05. This shows that there is no significant association between gender and KAP. Association of year of study and KAP of dengue. Among the first-year medical students, there is an equal percentage of them who have poor and good KAP score. Among the second-year medical students, 54% of them have good KAP score, while 46% of them have poor KAP score. Overall, higher percentage of first year have poor KAP score than second year, while higher percentage of second year have good KAP score than first year. Based on our chi-square test, P is equal to 0.653, which is more than 0.05. So there is no significant association between year of study and KAP score. However, the result is biased, as out of 146 total number of respondents, 100 respondents were the second year medical students, while only 46 of the respondents were from first year. Association of ethnicity and KAP. There is no significant difference in the percentage between good and poor KAP score among Malays, Chinese and Indians, but there is a relatively large difference in the percentage between good and poor KAP score in the other ethnics. Out of all ethnics, the percentage of Malays with poor KAP score is the highest, and 62.5% of ethnics other than Malay, Chinese and Indian have good KAP score. Based on the chi-square test, P is equal to 0.736, which is more than P is equal to 0.05. This shows that there is no significant association between ethnicity and KAP. However, the result is biased, as the number of respondents in each ethnic is not equally distributed. Based on the chi-square test, P is equal to 0.736, which is more than 0.05. Discussion. Most of the respondents are found to have basic knowledge about dengue fever, such as vector, mode of transmission, sign, symptoms, and prevention. However, there are still some students who are confused that blood transfusion is the mode of transmission of dengue fever, but actually dengue fever is transmitted by Aedes mosquito. Minority of the students thought that the vector of dengue fever is Culex and Anopheles, whereas the actual vector is Aedes. Several factors that cause students' lack of knowledge on dengue fever is due to less effort to obtain information, since the only source of information about dengue fever is from outdoor media, 9.6%, printed media at 0.2%, and TV, local or national, 6.2%. Although dengue fever is endemic in Malaysia, only 38.4% of respondents received recent information regarding dengue fever in the past 14 days. There is no significant relationship between KAP and year of study. Hence, to improve this, lectures given to students related to dengue fever has to be more in-depth, and small group discussions related to dengue fever has to be carried out. There is no significant relationship between KAP and gender, and there is also no significant relationship between KAP and ethnicity. Thus, necessary steps to have good KAP are to raise awareness of dengue fever through health campaigns, mass media, newspaper, and social media. With a good KAP, they can prevent themselves from getting dengue fever. Finally, the limitation in this study is there is no distinct separation of questions based on KAP in the questionnaire. Therefore, we could not investigate further the association between KAP. To overcome this limitation, further investigation and study should be done to look into how KAP is interrelated. Conclusion. Findings from this study provided important information that there is no significant difference between level of knowledge, attitude and practice towards dengue fever among respondents, including the Year 2 medical students. There is a need to increase knowledge among the respondents with multi-approaches. This study has limitations that may affect the generalizability of the results to other communities and populations. Firstly, the study involved only 146 respondents, which only focused on Year 1 and Year 2 medical students. Secondly, the recalling of information and collection of data may be inadequate as we solely depended on answers filled by the respondents via the questionnaire forms. In addition, respondents may misjudge some important information related to this study. Thank you for your kind attention.